Welcome to another production by the Millennial Mechanical Therapist. Your hosts, Dr. Joseph Gravino and Dr. Clay Case, are two physical therapists trying to treat health issues mechanically. Listen further for patient cases, guest videos, advantages and disadvantages of the way they practice, and much more. Thanks for tuning in today. Check us out on YouTube, Facebook, and at our website. We hope that you learn a lot from watching this video and you come back for more.
Hello everybody, I am the Millennial Mechanical Therapist, and today we're going to talk a little bit about data tracking. So lately in the clinic that I work at, we've been in the process of tracking a little bit more data than we normally do. Normally we just track number of visits and maybe days when you fill out some sort of assessment form, clinical metrics, and see, whether the year's progression or not across a certain time frame. But there was no, set day or specific time frame in order for our clinic as a whole. And partially, I think that has to do with we've had a lot of turnaround in our clinic, and now we have two therapists, both myself and another therapist who are McKenzie certified, who are working and really trying to get things a little bit more structured. So we put into order a little bit more structured pace. We are tracking our patients' numbers on day 1, day 2, as well as discharge. And so we're really trying to see, are we making a meaningful difference within a short period of time frame, and then when we're discharging them, as well as we're going to try and follow up with the individual, whether that is 6, 8, 9, a year down the line. We're going to do that now, so unfortunately the patients in the past, we're not really going to be able to capture that because there's a little bit more rigorous forms that we need these individuals to fill out. So needless to say, in the beginning of this, we started and a wonderful case came up that I thought was just amazing to showed us really how well we're doing things, as well as helps us see, changes, because every now and then you guys know, you get stuck in the minutia of paperwork and patients, and what happens? The good patients kind of get pushed off to the side, or the patients that are responding quickly, that love your types of therapy, kind of get pushed off to the side because they're so easy, and you're more worried about the troublesome patients, the patients that may not be so compliant, the patients that you're not really able to put a finger on. And I think we've talked about that in previous videos on what not to do when things aren't working, red flags, those types of things. And I won't speak upon that today. Today we're going to talk about a patient who just blew my mind. And originally I was going to name this video 100% better by day 2. But I think data tracking was a better name. And I'm saying that because we all have this little game now that we've been tracking, and whoever can seem to get an individual better by day 2 the most. So if someone got them 50% better versus 75% better, blah, 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 there's a little incentive at the end. And that's just to keep things interesting and mix things up in the clinic. But in the very beginning of this, I had a younger patient who came in with bilateral heel and calf pain. The script, I think, read bilateral posterior tib tendonitis. And I thought that was crazy, but whatever. And we've already even seen videos. We've pushed out videos on bilateral extremity cases, blah, blah. We'll push that all to the side. You've heard my spiels, my sticks, all with that. What I want to speak to you about today is this individual's really unique presentation. She had 4-month history of this. She wasn't an active individual. She didn't play any sports. She really wasn't even into recreation. When I asked her the most amount of recreation she got, I think it was like walking her pet. But she noted that things have been worsening over the past 4 months. She really couldn't think of an incident why it started. And she did note that originally the pain started in her right foot and then traveled over to her left and then kind of stayed in both. And it got worse and worse and worse, as well as she said that every now and then it goes to sleep, but she didn't really want to say that it was numbness and tingling, so to speak. So very weird things. Never a history of low back pain. And she's very young. She's a teenager. And then when we got into what sets off her symptoms, she said things like bending, Sitting for a long period of time can increase it. She can definitely have pain at rest. The first few steps from sitting hurts. Standing for long periods of time hurts. Standing for a short period of time sometimes seems better. Walking always seems to set it off. And things like squatting or kneeling even would set off her calf and heel pain, which some of those things sound like musculotendinous in nature or contractile dysfunction in nature, and some of those do not at all. So we kept, we went into it, no red flags, no real history of anything. Other things like swelling, clicking, locking, popping, nothing. So we go into more of the physical examination, and I looked at I did a neural exam, and she had like absent reflexes on the left lower extremity, which she previously said is right now the worst of the two, compared to the right lower extremity, which were more like +1. Her upper extremities were all like 1+, excuse me. And that seemed a bit weird. So I just took note of it. No real muscular loss. I think she had a myotomal loss on the left of S1, but I don't think it was something huge. I think I just was being precautious and there was a slight difference. Again, who knows how well we are at that. We'll push that to the side. Different talk. So no range of motion loss in the ankle. Phenomenal range of motion in her ankles. And she really didn't have pain with moving it. She did have end range pain with maximal dorsiflexion and eversion on the right foot. And she also had increased pain with overpressure into both dorsiflexion and resisted ankle dorsiflexion. Only on the right. The left, nothing. Again, weird, since she even said that the left foot was her worst foot. So, moving on. We go into, I always talk to people briefly about why I would screen their spine and everything above the joint, blah, blah, blah. So we go and look her back. She had a significant loss in right side glide of her lumbar spine. And when she extended, she actually had a weird deviation where she would deviate around and then go back towards the right. So she would deviate towards her left and then come around to the right, which I thought was very weird. And she said that, quote unquote, that's always been there. So, all right. What I did quick was I had her do some toe touches. I said, just do 10. So she did 10, and she made her previous symptoms worse. So she increased her risk. Now, some could say when you're stretching those muscles, because obviously you're blah, blah. You can't say that you're not pulling on any of the tissues down in the calf when you're doing that, and you want them to always reach end range. I get it. I take it with a little bit of salt. I lie her down to do prone press-ups. She has pain in lying. I check all of her mechanics again. Check all the baselines, all exactly the same. We do 10 press-ups without overpressure, without breathing out. Her pain's decreased. It's not gone, but it's decreased. We do 10 more, almost gone, but still there. I teach her the sag, all gone. No pain anywhere. No pain whatsoever. We go back and we check her mechanics. Her reflexes, exactly the same on the right foot now as the left foot. That was nuts. Her family was in, some of her family members were in the room, and they were just like, and I just looked and smiled, because pain followed suit, reflexes followed suit. I think we found the bad boy here. We go in, all of her mechanical signs. Pain with active dorsiflexion, no longer painful. Passive dorsiflexion and range pain, no longer painful. End range pain and eversion, no longer painful. So we go through the whole thing, and she understands what's going on. I say, let's just chase this. Let's see what happens over the next day. So she comes in the next morning. They were going on a weekend trip. I think it was the end of the week. We got her in the next day. Day 2. Comes in. Her and her mom are smiling in the waiting room, and she's in perfect posture, which I love. I love when patients, they probably didn't do it all day long. They come in, they sit in your office, and they're in perfect posture so you can see it, because it's for you. And she says, I'm 100% better. I have no pain in my ankles. And I said, that's awesome. You have no pain in your ankles? She goes, yeah, I have no pain in my ankles, 100% better, but my low back is killing me. And I just laughed. And it was funny, because the original situation when she came in with, she's now 100% better. Day 2, by the way, I didn't even put my hands on this individual. Day 2, all she did was repeat extension line with patient overpressure by sag or breathing out and posture. And by day 2, she was 100% better. That's insane. Needless to say, side note, I won that week. Coming back, we went over it. She needed a little bit more overpressure with some manual overpressure, and then back into fixing her technique with sag, no pain. This individual's going to do wonderful. I mean, I couldn't imagine her being there long, few visits, get her out. She's young, she probably heals fast anyways, but she's the definition of a quick responder. I mean, 100% by day 2. That's insane. I mean, this is why clinical data tracking is huge in our profession. It's so hard for individuals like us who are working in the clinic, we're in the, the trenches, so to speak. And how are we who are supposed to work, keep a caseload, put money on the table for you, your family, everything that you need to do, everything you want to do, because we love work, but we want to do things outside of work, and yet be able to contribute to the body of knowledge. That's our profession, and we all should be doing it. And this is a wonderful way that we can, and this is beautiful. Right now, I mean, not because I look good, but because this individual got better faster, is going to do so well. And yet we can show through data, through a lot of this stuff, tracking this stuff, that this is a thing, that this is happening, that this quick response to patient-generated response therapy via repeated movements, via the mechanical diagnosis and therapy assessment, is affording us these quick responses in a group of people. This is wonderful, though. This girl is going to go off live, 2 days. 2 days. If you could even, what a marketing thing this could be. I'm going off on so many tangents, but it gets me so excited because this is not my business, but if it was, what a marketing thing this could be. For one, that person's going to go and tell everybody they got better in 2 visits. And if not, what if you even just put out something saying a testimonial from this individual, right? So-and-so got me better, 100% better in 2 visits. If you come see me, there's a potential that you'll get 100% better in a few visits. I mean, that's huge in this quality world that we live in this market that we're living in, when healthcare is changing, when everything is changing, the way we get reimbursed, the way we're getting looked at, we gotta stop these passive treatments and start pushing for more stuff like this. It doesn't have to be MDT. I just listen to your patients. However you conceptualize it, however you can make them move, however you can make them feel better and empower them, do it. Because the way the healthcare market's going, people are going to find you if you're doing this stuff. Not specifically this, but listening and helping your patients get better quick. All right, and that's what's going to put money on the table sooner or later, not just holding people there for a while. I'm off my high horse. I'm sorry I kept this one long. I'm going to attach the day 1 and day 2 forms on this one for you guys. I'm going to try and get better at doing that a little bit more and more. I've seen seems more people like to see that, which is wonderful. I love sharing it because that way you guys can see some of the stuff we're talking about, and you can kind of see these are real people. Treating real people every day, doing this stuff, and I'm loving what I do, my friends. I love talking to you. I hope you enjoy this. Follow us on Facebook, subscribe to us on YouTube. There's gonna be more and more. The more we do this, the more people that are gonna be getting involved, and you're gonna see new faces. Hopefully some interviews on some fellows and things along the line. We got in the works, so hopefully we'll see you soon. You know what I say, my friends? Move your patients early, move them often, and move them to end range, because that's where the magic happens. I'll see you next time.